I'm absolutely delighted to be able to present the UK CLL Forum data here at iwCLL in Edinburgh. So we've got a large data set, 315 patients treated at 66 hospitals across the UK and Ireland that we've been tracking for 5 years now. Now, these patients were relapsed refractory CLL, a difficult bunch of patients. We've worked out their baseline characteristics, so really quite challenging. 15% of them were over 80, a quarter of them had poor performance status, well, 2+, so really, truly real world. And it's been fascinating seeing how their outcomes have panned out over these 5 years. We know that by 5 years, about a third of patients are still taking the ibrutinib. The median survival of the whole cohort is 55 months. We've been able to look at how certain prognostic things have panned out, so age, poor performance status, these are strong predictors of poorer overall survival. But also 17p deletion is now panning out, as I think we would have expected with longer follow-up. Perhaps not as much as you'd have expected difference for prior lines of therapy, but delving into that data, there certainly seems to be fewer progressive diseases in people treated a bit less aggressively in the past. But as time passes, there's an increasing incidence of disease progression for why patients stop. And those stopping earlier on are more likely to come off because of adverse events. And we've seen the full range of adverse events, as you would expect with this cohort. We've had some really interesting analysis looking at patients who are dose reduced and patients who had treatment breaks, particularly in the first year. And with our statistician, Amy Kirkwood, who's been tremendously helpful, we've been able to track these patients with a landmark analysis. So we defined subgroups 3 years ago when we published the paper, depending on how they'd been treated in the first year. And then we could revisit those patients and say, well, look, with the extra 4 years of follow-up, how have they done? And it's really fascinating. So those patients who were treated with no dose reductions or interruptions, they've got a good chance of still being on their ibrutinib, 75% of those patients, 4 or 5 years. But those who are dose reduced, well, most of them, so over 80%, are still dose reduced. So if your clinician dose reduces you in the first year, you're likely to stay dose reduced. They had a similar amount of progressive disease, if you look at the stats, around 24% in both arms, but double the amount of patients coming off because of an adverse event or for other reasons. So I think the message we've taken from that is if you've had problems or issues with your ibrutinib that's led to dose reduction, you're probably going to stay dose reduced and you have a higher chance of stopping ibrutinib. The other side of the coin is patients who had stopped ibrutinib for significant periods. Well, no matter how you cut the cake with those patients, their chances of being alive at 5 years are very much lower than with other patients. And then to round it off, it's a lot of data. To round it off, we've looked at what happened to those patients who actually progressed on their ibrutinib, and certainly those treated with venetoclax seem to have done much better, so that's reassuring for our patients that survival's actually, interestingly, perhaps even better than some of the clinical trial data, which surprised me a little. But there's a little bit of time bias there because we didn't have access to venetoclax early on, so those sicker, biologically more unstable patients were not in the venetoclax cohort. So perhaps we've got some selection bias, but overall fascinating data. And as I round off this quick little run through, can I just thank all the clinicians, so many haematologists across the UK and Ireland who've given their time to this project, and I am grateful.